The Community Memorial Health System Speaker Series Online is brought to you by Mission Home Health. Mission Home Health and Hospice is committed to taking care of people by providing the highest quality, cost-effective care wherever the patient calls home. With over 14 locations, Mission delivers skilled home health, hospice, and palliative care services to more than 3,000 patients a day. As a preferred partner with several health systems, Mission works with providers to customize each partnership to provide exceptional coordinated care. Visit our website to learn more at www.homewithmission.com. We take care of people, and one call does it all.
Hi, welcome. I'm Dr. Saranya Reghunathan, and thank you for joining us this evening to learn more about the laryngology services offered at Community Memorial Health System. Again, my name is Saranya Reghunathan, and I'm a board-certified otolaryngologist, head and neck surgeon, with subspecialty fellowship training in the field of laryngology. I'm a Ventura County local, born and raised in the area, and I subsequently matriculated to medical school in the Midwest. After proceeding with medical school in the Midwest, I moved to Arizona to pursue my otolaryngology head and neck surgery residency. I subsequently went to Cleveland Clinic in Ohio to have my subspecialty fellowship training in laryngology, and immediately returned back to the area to serve my local community. I practiced the whole gamut of head and neck surgery for all ages, both adult and pediatric. What is laryngology? Laryngology is a subspecialty of otolaryngology that deals specifically with illnesses and injuries of the larynx or voice box. The larynx is an organ that's located in the front of the neck and houses our voice box, our vocal cords. The larynx has three critical functions: 1, breathing; 2, creating voice; and 3, serving as a gateway to direct air into our lungs and food into our esophagus. What is a laryngologist? Well, we're head and neck surgeons who have further specialized in the treatment and management of disorders of the voice and upper airway structures, such as the throat and trachea. We also have specialty training in bronchoesophagology, which is lower airway and swallowing disorders. What kind of conditions affect the larynx? Well, any difficulties with breathing, swallowing, or speaking, some of our most vital functions. Conditions that affect the larynx include disorders of the larynx that affect our ability to speak and swallow properly. Voice and swallowing problems can develop from injuries, allergies, or more serious conditions such as cancer. The larynx can be affected by surgical procedures of other sites, including heart surgeries, lung surgeries, other chest surgeries, vascular surgeries, spine surgeries, and including placement of a breathing tube during surgery or during a hospitalization. When should a patient see a laryngologist? Well, specifically, anytime the voice remains hoarse, especially in a professional voice user like an actor, singer, or teacher, or in someone who's noticed persistent hoarseness for more than 2 weeks. Anytime someone has trouble swallowing or pain with swallowing, and anytime someone has a lot of trouble breathing when exerting oneself. Typically, laryngologists provide both diagnosis and treatment for both routine and complex problems that affect the voice and swallowing and breathing mechanisms. When should you see a laryngologist? Has your voice become hoarse or raspy? Does your throat often feel sore, achy, or strained? Does talking require more effort than usual? Do you find yourself repeatedly clearing your throat or feeling like there's something stuck in your throat? Have you lost your ability to sing at higher pitch levels? Has your voice been abnormal for more than 2 weeks after a cold? Do you have trouble swallowing solid or liquid foods? If you or a loved one has experienced any of those symptoms, I highly recommend that you see a laryngologist. Now, what does a laryngologist do? Well, we do minimally invasive and endoscopic treatment of most laryngeal, esophageal, and airway pathology. Now, what does that mean? Well, what we're known for are our in-office assessments and treatments, specifically video stroboscopy. Video stroboscopy is a procedure that is a non-invasive exam of your larynx that we do in the office with you awake. It's thought to be the gold standard of laryngeal examinations. The video stroboscopy procedure is a state-of-the-art procedure that provides a doctor, me, with slow motion magnified view of your vocal cords in action. It helps us make judgments regarding also neighboring tissues and the muscles of the larynx. Now, there's various uses for video stroboscopy. Specifically, it helps us determine the cause of the voice problem or hoarseness. Could it be a polyp? Could it be a mass? Could it be vocal misuse? Is there inflammation? Is it acid reflux? We can tell that all just from video stroboscopy performed in the office while you're awake. It helps us visualize your vocal cords and evaluate the function of the vocal cords and the voice box. It helps us detect vocal cord lesions and other irregularities like inflammation, scar tissue, or muscle tension conditions. It also helps us assess swallowing issues, which could be caused by muscle abnormalities. Now, vocal cord vibrations are much too quick for the doctor to observe with the unaided eye. So video stroboscopy provides me with illumination of the larynx with fast light pulses, which allows for a detailed and accurate assessment of vocal cord motion. Now, by looking at your vocal cords and the larynx in the office, I can tell you during our office visit why the vocal cords are not functioning or why you're having a swallowing issue, and come up with a tailored treatment plan for you during our first visit. Now, the other benefit of video stroboscopy is if you require another exam at a later date, we can compare your exams and see what your progress has been. Now, laryngologists provide specialized treatment for the following conditions, including vocal fold immobility or paralysis, narrowing of the voice box or the airway, vocal cord dysfunction, lesions of the voice box like polyps, cancers, papillomas. Benefits of seeing a laryngology specialist include the ability to effectively evaluate more complex cases using specialized equipment, ability to diagnose nuanced disorders that may have otherwise been missed, provide a more comprehensive and effective treatment plan, oftentimes by evaluating you at the first visit with video stroboscopy. And we work collaboratively with our other local ENTs and our speech pathologists to provide continuity of care for our patients. Again, I'm Dr. Saranya Reghunathan, and thank you so much for joining me this evening. If you have any additional questions about the laryngology services offered at Community Memorial Health System, please visit us at cmhshealth.org. And if you'd like to see me, please come visit me in my Oxnard office or call me at the number listed on the screen.